All right, we are continuing on in chapter 12, studying the heart. There is a section that explains the cardiac cycle in a whole lot more detail, but we're trying to keep things simple since we're doing 3 chapters in one topic, basically. The cardiac cycle is defined as the period between the start of one heartbeat and the start of the next. So it's really like one heartbeat. The events that happen in the heart during one heartbeat. So the contraction phases are referred to as systole. The relaxation phases are referred to as diastole. So just remember, contraction is systole, relaxation is diastole. So during diastole, the chambers of the heart are filling with blood. They're relaxed and filling up with blood. During systole, the chambers of the heart are pumping blood or ejecting blood. So that's not everything that you need to know about the cardiac cycle, but it's a pretty good, summary. The heart sounds that we hear during the cardiac cycle, if we listen to the heart with a stethoscope, we're going to hear the first sound as a lub, and that is produced when the AV valves close. That's the louder of the two sounds. And the second heart sound is called dup. So it's lubbed up, lubbed up, lubbed up, lubbed up, lubbed up, like that over and over. And the second heart sound comes from the closing of the semilunar valves. So the tricuspid and bicuspid valves closing, that causes the first heart sound. Then the aortic and pulmonary valves closing causes the second heart sound. And then sometimes we'll hear other heart sounds for different reasons. Now, heart dynamics or cardiodynamics refers to movements and forces generated during the cardiac contractions. One volume that we measure is called the stroke volume that we measure, to determine the health of the heart. And that is the volume of blood ejected by a ventricle in one beat, one heartbeat. That's how much blood is being ejected during one heartbeat. And then the cardiac output is the volume of blood ejected from the left ventricle in 1 minute. And it's an indicator of blood flow through the peripheral tissues. So, kind of like an indicator of tissue perfusion as well. So if we want to calculate cardiac output, because it is a calculation, we have to know the stroke volume and the heart rate. The stroke volume average is about 70 milliliters. And then the heart rate average is 60 to 100 beats per minute. So average cardiac output is about 6 liters per minute. 6 liters per minute. All right. Some ways that the heart rate is regulated. Well, first of all, you have to understand that the pacemaker cells of the SA node establish the basic heart rate. And then the autonomic nervous system can modify it. And we have 2 branches of the autonomic nervous system. We have the parasympathetic and the sympathetic. So the parasympathetic will cause the heart rate to slow, and the sympathetic stimulation will cause it to speed up. The parasympathetic stimulation comes from the vagus nerve, which is cranial nerve 10, and the neurotransmitter involved is acetylcholine. Sympathetic stimulation comes from various nerves, and the neurotransmitters would be norepinephrine and acetylcholine, both. Again, the parasympathetic pathway slows the heart rate, and the sympathetic pathway increases the heart rate. Now, in addition to speeding up or slowing down the heart rate, the sympathetic nervous system can increase contractility, which means the force that the heart contracts with. So increases the force of contraction or contractility, and that will increase the stroke volume, which of course will increase the cardiac output. So the sympathetic nervous system can increase contractility, and the parasympathetic would decrease contractility. In the medulla oblongata, in our brain, we have a cardiac center. And it's divided into the cardioacceleratory center, and that controls sympathetic motor neurons that raise the heart rate, and then the cardioinhibitory center, which controls the parasympathetic motor neurons that slow the heart rate. All right, we have one question here. So if the cardioinhibitory center of the medulla oblongata were damaged, which division of the autonomic nervous system would be affected? So first answer is the parasympathetic. And how would the heart be influenced? Well, it wouldn't be able to, the parasympathetic wouldn't be able to slow the heart rate, so it would be faster. And that is it for chapter 12. We'll move on to 13.